Hello everyone, a very happy respiratory care week. This is Dr. Vaijayanti, an ICU consultant in Rujuta Hospital. I would like to wish my respiratory therapists Aakash, Soni, Rujuta, Bagade and Ashish Yadav a very happy respiratory care week. And I would like to say a few months back when we got affected with COVID pandemic, when we had patients loading in our ICU and with respiratory problems, we had a lot of issues with dealing with the patients, with our nursing staff, with our new doctors coming in. And suddenly we found there was a big gap of communication in between the nurses, the doctors. They were not able to understand the dynamics the patients had in their system. So we then got recruited these respiratory therapists in our ICU, and things suddenly changed. The way we managed our patient and the way our outcomes improved were amazing. And since our respiratory therapists are in continuous contact with me, things became so easy for us because we had one-on-one communication every day for our patients. These guys would every day be inside the patients, near to the patients, understanding their respiratory problems, understanding their complete system, not only the respiratory system. They would go assess the patient first properly, get down with the problems, what exactly they are suffering, what they would explain the patient how they are supposed to breathe. They would discuss with me personally every day what would be the better choice of oxygen delivery system for these patients. So every day it would be every day their inputs would be so important for us, and they being near the patients, when we saw these respiratory therapists working inside, they were so fearless. They would not. My experience with my respiratory therapist was amazing. Always I would see them whenever I would come for my rounds. I would always see them near the patient, talking to them, helping them with their masks, with their helmets, and they were so fearless, and that increased our confidence during the therapy of these patients. And what we could see is our definitely our mortality had changed in all these months, and we as doctors taking care of these patients were so comfortable when my respiratory therapists were inside, when our respiratory therapists were inside, and we knew that things will be definitely better. And yes, they were definitely better because the understanding of the respiratory problems was so much better than the nurses, than the junior doctors who were just recruited, who are just who do not really know. They take up a responsibility of even teaching those few things about the ventilators to our residents as well. Understanding the ventilator problems. If there is a ventilator which is not working, they would find out that yes, there is a troubleshooting. So all these small things were so much important for the treatment of our patient. And few months back we didn't even realize that we really needed them, and now if they are not there inside the ICU, I start getting palpitation. It's that way. And it's a fact because they have become such an important core member of our critical care team that frankly speaking, now if we are asked to work without them, I think for me it's going to be very difficult. And yes, it eases our stress as well. It's a big thing, I suppose, for a critical care team. I think these respiratory therapists they are like the role models in the critical care, and they definitely have to be a part of critical care because there are so many things changing nowadays in the ICU that they form a very vital part, and their knowledge regarding the ventilators, the patients, the respiratory system definitely helps us in all the ways. And I'm so thankful that I have this kind of people in my team, and we have definitely got one step ahead in the treatment of our patients, and our patients are having amazing feedback with all these respiratory therapists working with us. We have got several feedbacks, good feedbacks from all of our patients regarding our respiratory therapists, because they are always talking to the patients, they are always communicating with the patients, with the nurses, with the doctors, and they are doing a great job, I feel. And I cannot see my eyes without the respiratory therapist. And of course the rehabilitation, the post-COVID care nowadays, which is so much important, they all participate in all this. They're so enthusiastic. That enthusiasm really takes us, it will take us a long way, I feel. And I would definitely want all of these guys to do really well in this in their career. And yes, the critical care, it doesn't work without respiratory therapists. That's what I feel nowadays. Thank you so much.